Hey folks, Dirks Bentley here. If you've seen one of my concerts, you know I'm all about energy. Performing, recording, traveling, being a husband and a father, it's a busy life, and I need to be 100% every day. So when my battery starts running low, I grab a sugar-free, vitamin-packed 5-hour energy shot. It tastes great, and it gets me back to 100% fast. Try it. It could work for your busy life too. For more information, visit 5hourenergy.com.
I'm not the house of cards that falls down easily. Ooh, I'm strong enough to handle what you throw at me.
Welcome to Mental Health News Radio. I'm your host, Kristen Sunanta Walker. Just what are we going to discuss? The intimacy that is mental health. Let's continue to make it as comfortable as discussing brain health or heart health. This show has been on the air for several years, and we have amazing co-hosts. And then we created a network of podcasters on mentalhealthnewsradionetwork.com, a place where every possible facet of mental well-being can be talked about openly. My show, after several hundred interviews, the format is this: intimate, deep, funny, touching, sometimes uncomfortable, but always vulnerable conversations with interesting people. The goal is to have you, our listening family, many of you who have become my good friends, feel as though you are listening in on private conversations. Thank you for tuning in and becoming part of this amazing journey with me, and now with our network of podcasters. Just knowing this podcast might be helping any of you realize you are not alone on this journey called being a human being makes doing this podcast worth every second.
After all we promised, we'd be cordial.
Hey everyone, Kristen Sunanta Walker here with Mental Health News Radio, and back on our show after a long hiatus, not because he's been suntanning somewhere on an island, but because he's been busy working, is Dr. Marc Feldman, expert on Munchausen Syndrome by Proxy. We did a wonderful show. Marc, thank you for coming on first. And how long ago has it been? Has it been like a year?
I think it's been even longer, if I'm not mistaken, but I'd have to check.
Yeah.
Too long.
Too long. Exactly. It was such a great experience. I think Melanie was on the show with us for part of it, and we were like, we need to have him on more.
Yeah, and I'm really happy to do it.
Awesome. And also, Andrea Avigal joins us. She's written a wonderful book that we're going to talk about in the interview, and she might be a little bit nervous. And I've said, as you listeners know, this is like the most comfortable place to be. So, Andrea, thank you so much for coming on the show.
Yes, thank you. Thank you for having me.
Absolutely. So let's talk about first, Dr. Marc Feldman's book is Dying to Be Ill, True Stories of Medical Deception. And I downloaded it like the nanosecond I could. And now I'm going to have to get Andrea's book because I didn't know that you had one, Secrets Unraveled, Overcoming Munchausen. How in the world do you two know each other? How did you start? Because you said before we recorded, or before I hit record, that you hadn't ever spoken. This is your first time actually speaking. So, Marc, if you'll go first, how is it that your relationship came to be?
Well, I was contacted years ago by Andrea's then therapist, who indicated that he and Andrea together had written a book summarizing what was a successful psychotherapy for her Munchausen Syndrome and Factitious Disorder. And he asked me to take a look at the book, offer ideas, thoughts, and I even offered the subtitle. So I was glad to read it. It was very engaging and fascinating, really. And we got to know each other as a result of that book and have stayed in touch ever since.
That's wonderful. Andrea, how's that been for you, this relationship?
It's been wonderful. I think there's one piece that Dr. Feldman doesn't know. My therapist at that time actually contacted him several years prior to the book being even written, when he was kind of at his wit's end, when my disorder was at its worst, asking for some help. Mm-hmm. And Dr. Feldman was ill at the time, and he received a letter back from his wife stating that he was ill. And I'm not sure if you ever knew about that or not.
I don't think I did. This is all new to me.
Yeah.
But I'm glad to know.
That's what
I'm
I
glad
thought.
to know the history.
Yeah.
So I want to get
But we did use your book. We both read your books at that time, the other books that you have written, and we utilized a lot of help from your books as we were both kind of stumbling through the process.
Yeah, and it's been a great relationship ever since. I don't have contact with her then therapist any longer, but the important relationship was the one I established with Andrea, and that's continued.
That has to be fascinating for you, Marc, to get to really, I mean, I know that you can see this from looking at the outside, and a lot of people come to you with cases that they're working on and they're the primary person, or it's a court case or what have you, but to get inside the mind of someone who's willing to open up and share this is, first of all, very brave, Andrea. I mean, you're helping so many people by doing this. So, bravo to
Thank you.
And really for you, Marc, I mean, it's had to have just helped you immensely with, treating this and understanding it.
Yeah, one of the things that's been just great about my having studied this field, and I've done it now for over 25 years, is that many of the patients are very willing through the anonymity of email to tell me their stories. They sometimes go into much greater detail and are more frank than you would expect if we were meeting face to face. People get a little edgy with the face-to-face meetings, especially if it's in the context of a formal psychotherapy meeting. But through the anonymity of email, I've learned about a lot of patients and their narratives. Their personal lived experiences are what really filled the book, Dying to Be Ill. As anyone who looks at it will see, there are 50 to 60 personal accounts from all sorts of people, not just patients, but therapists. In the case of medical child abuse, law enforcement, nurses, therapists, it goes on. And again, the generosity of people in sharing their stories has been amazing.
Just so everyone knows, that maybe doesn't know what this disorder is, I know that I'm going to type in a keyword that everyone that knows what it is going to jump on it like they did with your last show. But, we have other listeners too that'll tune in just to hear what the heck I'm going to be talking about next. So can you give an explanation of what this disorder is?
The technical term for what we're talking about is factitious disorder. It's like fictitious, but with an A at the beginning, factitious. And that's the formal American Psychiatric Association term. It's been recognized as a mental illness since 1980. But most people know of it as Munchausen Syndrome, which is a term that's been around much longer. And it refers to people who feign, exaggerate, or actually self-induce illness in order to gain emotional gratification. And that may be attention, sympathy, care, concern that they feel unable to get in any other way. People also know about the variation called Munchausen by proxy, where in usual cases a mother, again, feigns, exaggerates, or induces illness in her child in order to gain recognition for herself and what appear at first blush to be exemplary mothering skills. So it is a mental illness. It's not taken as seriously as some other mental disorders like depression and schizophrenia, but it needs to be, and that's been the focus of my work for a long time.
I think it's interesting that, factitious, so to me that it's so closely tied to narcissistic personality disorder. And I'm not the expert on this at all, but even just the term factitious, narcissists are known for, nothing is an actual fact when you're dealing with them. So, because they live this fantasy life or this persona. So how is it different, I'd say, or alike that kind of a disorder?
Well, as you're correctly pointing out, they often coexist. So I would say that most people with factitious disorder have a personality disorder as well, which means that they have chronic maladaptive ways of trying to get their needs met. And what we see in factitious disorder is people who, instead of being able to ask in straightforward ways that their needs be met for affection and care, they use this roundabout and ultimately self-defeating mechanism of self-harm. But narcissistic personality disorder is probably even more prevalent in Munchausen by proxy,
Right.
because these are mothers who prioritize their needs over that of their own child. And that's about as narcissistic as you can get.
Right, exactly. Andrea, what do you think when you hear something like that? Because for you, it was Munchausen related to yourself, not your children, correct? Is that correct?
Correct. I think that when it comes to Munchausen syndrome, correct me if I'm wrong, Dr. Feldman, that more of the time people are diagnosed with borderline personality disorder. And
Interesting.
I don't,
I think that's
is that
true.
correct?
I think you're right about that, Andrea.
And for me, what that means only is that there's a history of trauma, typically childhood trauma.
Right.
And from a lot of stories I've read and people who have contacted me through my book who were seeking help also described a history of childhood trauma or abuse. The problem is that a lot of the mental health community has some level of disdain towards patients who have that diagnosis
Yes, they
of
do.
borderline personality disorder. And that can be a real problem because if you combine the two, that with feigning illness, it really is, it makes it even more difficult to put yourself out there in such a vulnerable position and to disclose what's really going on, because you're aware of what's going to happen and how, the negativity is just going to, come out so strongly towards the patient, or as it did in my case, it was terrible with the doctors and nurses, how they treated me after they found out everything.
As Andrea was talking, I was thinking about a book review for my last book, Playing Sick, that was published in the American Journal of Psychiatry. The first half of the book review, which was by an expert in other fields, was wondering aloud why anyone would write a book on that subject. And the reason he said that was because these are patients that most of us have learned to avoid at all costs.
Wow.
And it just revealed his own bias, which is characteristic of many in the field, against these patients, as people with personality disorders often experience as well. And it was a very frustrating experience. I tried to find him and talk to him about it, and he made himself unavailable. So it just shows that there is indeed this stigma, not only against people with mental disorders in general, but I think particularly against those with diagnoses like factitious disorder and borderline personality disorder.
That's absolutely true. I mean, I see it in terms of shows. Every time, I know I haven't done that many, but I did a show with someone about borderline, and it just ticked so many people with borderline off because the person just wasn't very sensitive, and he's a wonderful human being. And so I purposely did other shows with people that have that diagnosis to say, okay, well, here's the other side of this too. Because, I'm trying to be fair and balanced here, even with my own stuff going on. I wonder from both of you, what gets this to a level of being a disorder? Because a lot of people do things that are self-harming and get their, people get in addiction, people, many people can live their life as if they're trying to kill themselves because they don't want to be alive. But, at what point does it dip into disorder land,
Yeah, I think when you look at the intensity of the disruption to these patients' lives as a result of their Munchausen syndrome or factitious disorder, you see that this is indeed a mental illness that they're unable to control in most cases.
Okay.
It may appear that they're making just simply bad decisions. They're engaging in misbehavior. And in fact, there was discussion about eliminating factitious disorder from the most recent Psychiatrist Bible, the Diagnostic and Statistical Manual of Mental Disorders. People were saying, well, they make choices to harm themselves in this way. But the point is, we provided evidence of just how disabling factitious disorder can be in the more severe cases. And they were finally persuaded to leave it in the manual, which is very important. But at the same time, organizations like the National Alliance on Mental Illness have no resources for patients about factitious disorder. And it is clearly, in my opinion anyway, as somebody who's spent a lot of time working with these patients, as disabling in some cases as schizophrenia is.
Right.
I mean, that sounds like a hyperbole, but it's really true. And I think Andrea can shed some light on that through her own experiences.
Yeah, it was definitely disabling. For me, my childhood was extremely traumatic, but it was very harsh. My father was a Holocaust survivor, and his level of neurosis and dysfunction was so severe from going through that experience. And it just became generational. I mean, even the children, my children and my siblings' children, I mean, have been affected. All of our children suffer from anxiety disorder, and we all have some, level of mental illness. Of course, it's on a continuum, and some of us function higher than others, but we all have some level, and it's all affected. And I do have a lot of blame on what happened during the Holocaust and how severely that affected my father and my grandparents, because he became so emotionally ill. But it made sense when my therapist at that time said that he understood the disorder as being so harsh because the childhood was equally harsh. And it just made sense that my coping skill became something that was, just as disturbing in order to manage the feelings or what I was experiencing, at that time of how to deal with the PTSD from the childhood.
Yeah, I mean, I can see
and anxiety.
Yeah, I can see exactly why this would come back. I mean, in a very clear way, it makes sense what you're saying. I mean, that your father was a Holocaust survivor and you have this particular disorder. That, to me, this seems very clear. Does that make sense?
Yeah, and part of my story that Dr. Feldman knows is that I was abused and treated badly during childhood, and then I had tonsillitis and I had a tonsillectomy when I was young, and I was treated very well by my parents, particularly my father, who was the abuser, and that demonstrated, the equality of sickness and caring.
Yeah.
Correct. But the other piece that Dr. Feldman doesn't know is that there was a lot of illness when I was a child. My mother was very ill for a very long time. And so I was surrounded by illness from a very young age through most of my young life into early adulthood. And my father would always treat her, very, very well, like a queen when it came to her illness. So I was taught a very valuable lesson when it came to illness that obviously I wish I hadn't been taught. And then my firstborn child was diagnosed with brain cancer when he was 2 years old. And he unfortunately passed away at 13. And that's when my Munchausen syndrome spiraled out of control. I really could not handle the death of my son. And that's when it became its worst.
Wow. Yeah. I mean, this does come out of trauma. That's so interesting that you must have had a horrible time trying to get someone to be compassionate with you and actually help you get through this,
Yes, and I was fortunate to find a psychologist who was willing to go the extra mile and really above and beyond to try to help. And by him, by the fact that he was willing to go so so much above and beyond. I was able to establish a relationship as trusting as I could possibly be with another person.
Right.
And because the relationship was so trusting, I was eventually able to reveal to him what the truth was and what I was doing. Because for several years into the therapy, he did not know that it was factitious disorder. He knew that I was contributing somehow to being sick, but he didn't realize that I was completely creating all the illnesses.
What kinds of things were you creating in terms of illness, Andrea?
I was injecting myself with into my veins with saliva, which the bacteria causes sepsis, which maybe you could explain it better than I can, Dr. Feldman, what sepsis is.
Well, certainly it's just injecting any form of concentrated bacteria into the veins, and people use lots of different things to do it, will induce an infection that can get out of control and cause a blood infection called sepsis.
Where, Dr. Feldman, would you turn a line into, okay, addiction, someone who is injecting heroin or, methamphetamines or whatever into their system? Where's that line between this is someone who we would call an addict as opposed to someone who we would say has Munchausen syndrome?
Well, once again, I think the two can overlap. And one of the points we make in the book in talking about the reasons people engage in Munchausen behavior is that it can be conceptualized as an addiction. I've been surprised at how often patients use the word addiction to describe their powerlessness over their own self-harm. And there are even some patients, believe it or not, who have developed and worked 12-step programs where the focus is on their Munchausen behaviors rather than substance-related behaviors per se. And they found it helpful in combination with other forms of treatment. It's hard to arrange that because one of the things that's most important about 12-step programs is the group support. But people have tried to develop groups online and then rewrite the 12 steps so that it's directed more toward Munchausen behaviors and then develop a community of support that way.
So in terms of Munchausen behaviors, from a doctor's point of view, what are some of those behaviors that, you can explain to our listeners?
Some of the most common things that people do to themselves?
Yeah.
Well, I think probably most people falsely report or exaggerate symptoms.
Okay.
That is, they fall a bit short of actual self-induction of symptoms. But simply going to a doctor and claiming, for example, that you have episodic fevers without actually experiencing those fevers is likely to cause a ripple effect of increasing numbers of tests, diagnostic procedures, sometimes even surgery. It doesn't take much. Doctors are taught to listen closely to what patients and families tell them. They're not taught to ever question what they're being told. And so you'll see, and I see this all the time, tests being done over and over and over, or so many tests being done that something emerges as a little abnormal. And then they seize on that as the explanation and do further subspecialty work. And it just takes on a life of its own that's very destructive and can also be to the patient quite seductive.
Right.
So it takes someone like Andrea a lot of hard work to avoid that seductiveness and all that energy being dispensed in the person's direction to say ultimately, no, I'm playing a role in what you're perceiving as my illness.
Yeah, Andrea, I was thinking about that too. I know, no one likes commercials, but seriously, folks, without the help from these organizations, we could not stay on the air. Please give a shout out to zencharts.com. If you're a mental health or addiction treatment center, you'll want to use their EHR. It's gorgeous, and they're just good people. and also mygenetics, mygenetx.com, because knowing your genetic code empowers your mental health treatment. And lastly, copenotes.com. We love getting positive messages right to our phones every day from Johnny Crowder. He's the lead singer of Prison, a heavy metal band sharing their music about suicide prevention, addiction recovery, and mental health. See, that was painless. Support them as they support us. Back to the show. So that had to have been such a big moment for you to trust. I mean, listen, a lot of people I know, obviously in the field that I'm in, a lot of people I know go to therapy, but they don't really, I mean, a lot of people I know go to therapy and they don't ever really get to the root of what's going on because they aren't even honest with their own therapist. So for you to say this, did you know what it was you were talking about when you actually came out with it in front of him?
The funny thing is that I had no idea really what was wrong with me. I knew what I was doing, and I knew that it was destroying my life and my family's life and lives. And it wasn't until I read Dr. Feldman's book, Playing Sick, that I learned there was a name for this. And that was an eye-opener after I read that book. I couldn't believe it, that it was an actual disorder and other people did this also. And that was really helpful when I found your book. And I think that's when things kind of started to change, because I realized that, there was hope, and maybe I didn't have to live this life, forever, that there was a chance that that I could have a better life. It was a combination of that. And I think, like an addict's behavior, I hit bottom. I became very, very ill, and at one time I created sepsis, and I was in ICU, and I was very, very sick, and I wasn't sure if I was going to live or die at that moment. And because I came so close to death, my therapist gave me an ultimatum. He said that because that was part of the trust building, he had decided to not tell other people, the medical community, that I was fabricating the illnesses. He was trying to encourage me to do it myself. Right. And I refused to do it because I knew that it was not going to be a good outcome, or I was scared, I suppose. Right. And he finally said that was it. You've gone too far. You tell or I tell. And so I had to tell. And once the cat's out of the bag, it's kind of hard to continue the behavior.
Right. Change your name, move to a country.
It spreads like wildfire. Also, people get sometimes excessively fascinated by the behavior, or it's almost voyeuristic in some ways, the way doctors talk about it and nurses do, and they share information, and you get stigmatized very quickly. Yeah. So I understand the reticence to come forward in case after case after case, but sometimes there is this life-threatening moment, and you'll see a few cases like that in Dying to Be Ill, where people have gone too far and promised themselves or had somebody make them promise that they would disclose the truth if they recovered. And that can sometimes be an extraordinary turning point.
Yeah, I mean, go ahead, Andrea. I was going to say that had to be an extraordinary turning point for you.
Yeah, it was very scary. I mean, it was definitely an addiction for me. I wanted so badly to stop, and yet here I was doing it time after time after time, and I didn't know how to stop it. And it was such an awful place to be in. And at that moment, my husband actually was aware of it, because my therapist did tell my husband what was going on, the truth of the situation, and he was furious for quite some time. For years, he was furious, because it disrupted his life to such a terrible degree. And to learn that I was doing all of this on purpose, it was hard to understand. But it was so scary, because I knew that either I stopped or I was going to die. I was going to kill myself, and I didn't know how to stop. Right. And it was such a terrible time.
So in terms of therapies that helps you, what, what things can you attribute to you being able to say I'm in recovery or I'm recovered from this?
Well, I believe I'm recovered because it's been so many years. It's well over 10 years since I engaged in any behavior. And I just no longer have the urge or the desire. There are stressful times in my life when I think of, for me also being sick was an escape from responsibilities. And going in the hospital was, a way to just not deal with the harshness of life. And but I just can't imagine ever going back to that life. I just can't imagine it. It was so difficult. It's such a hard life to maintain, as crazy as that sounds. It's really, really difficult to just keep it going, and the lies and the having to keep that lie going with everybody that you know. It's exhausting. It was exhausting.
Yeah, you asked earlier about the difference between factitious disorder or Munchausen syndrome and what we call non-suicidal self-injury, where someone may carve on themselves.
Right, I was just going to bring up cutting.
Etc. Yeah, the self-cutters or self-burners are best known. Most of them will acknowledge that they are the source of their injuries. If it may be just patently clear and obvious from their injuries that they've done it to themselves, but they tend to admit that they were the source, whereas in factitious disorder, there's just so many risks to doing that people don't. They lie about it, they deceive others, and that's a cardinal feature of Munchausen syndrome that you don't see in mainstream self-harm.
Gotcha. That's interesting. Mainstream self-harm, and it's sad because it is mainstream.
Yeah, I hate saying that, but as somebody who's worked in this field, I've seen both the Munchausen syndrome and the non-suicidal self-injury. And the latter is so common, especially among adolescent girls. And we just don't have a handle on what the single best treatment is for that.
Oh, gosh, yes. That and eating disorders, right on up
and eating disorders, which can be so fatal, have the highest fatality rate of any mental disorder.
Right, exactly.
I actually created an eating disorder during that time and used that as a way to make myself very ill when it wasn't really truly an eating disorder. It was just another way to create illness, but it was much more accepted.
So what were you doing?
Pretty much starving myself and taking massive amounts of laxative.
Interesting. So that in doing this, and then, deciding to write a book about it, I mean, that's like the biggest out that you can do of yourself. It's one thing to say it to your personal therapist and your family and, to the medical community. And then there's like putting it in a book that a bunch of strangers are going to read. So inevitably, I'm sure that you had some negative feedback from people on a bigger scale because of the book. So, and I know you got a lot of positive, but I wanted to ask you, how did you deal with the negatives that came in and the stress because that's like, here's my wound. I've opened it up and shown the world. And now someone is like pouring salt in it, So what did you do to cope with that without falling back into, the disorder?
That was very hard because I did get a lot of negativity, which was really unexpected. I thought that everybody was going to be just so impressed with the fact that I recovered and I stopped engaging in all this behavior, and I really was a little bit taken aback that people had no problem expressing the negativity about what I had done. It was hard to deal with it. It made me, just question writing the book and putting it out there. And it was really very difficult to deal with. I I spent many nights crying and just feeling very bad about myself and an enormous amount of guilt, especially when people questioned my parenting and my mothering, because I tried so hard to be a good mother. I had a sick child for many years that I cared for, and I had 2 other daughters, and I know that I was emotionally absent during that time, that I was, so physically ill from the Munchausen Syndrome. But I felt like I was trying so hard to balance the both, which just is insane.
Right.
Yeah, but my daughters still talk about their childhood as really not a terrible childhood, other than, yes, there was unfortunately a lot of trauma, but they said that they felt very loved and very cared for, and I'm just very thankful for that.
Yeah, it's interesting when you go out on a platform and publicly. I mean, I got used to having, I'll say it this way. I went to a spiritual healer who's on our show, Martha Jaknowski, and because I'll do anything to be well. And what was interesting was she was like, well, first of all, we got to clear every sword that is stuck in you, because there's not even any skin left. Mm-hmm. And she meant psychically, of course, because I started talking about incest and sexual abuse when I was like, very, very young, in my teens. And the reaction from people, a lot of people, especially at that time, now you can just say that and nobody really says anything. But at that time, it was 1984. And I had some angry people like scream at me and, at a speaking event. And I was like, wow, thank God I was in therapy, because I knew immediately to think, wow, they're projecting. Like, what are they, what did I just trigger? But it's hard to do that, to put yourself out. And I'm thinking for you, Dr. Feldman, I mean, I respect you because I know that this is real and I grew up around this. But within the medical community, it just hit me. You must have experienced a lot, I would think, from your own colleagues, like you had said before. Just why are you even in this field? Because they just don't believe that it's real.
Absolutely. I first saw a Munchausen patient in 1989, and I was referred the patient because no one else would evaluate the patient or treat her. That already tells you something.
Right.
And the situation is scarcely better now. It's somewhat better. I've now written 4 books dealing with the subject, though only this last one includes so many patient narratives, first-person narratives. And it also has the biggest chapter on healing, because I've learned a lot from patients and from my own experience about ways people can get better. So I've always retained hope for these patients, but it's been stigmatizing, not just for patients, but for me at times to be in this field. One of the indicators is the fact that no foundation or the federal government has ever given a grant for study into Munchausen syndrome. Everything else you can think of, there's an office that focuses on rare diseases, and very esoteric ailments have received funding, but I've tried and tried, and every bit of research I've done over the years has been paid for out of my own pocket. That's just the way it has had to be. And that's disappointing.
It is, and
it's so sad.
Yeah, I want listeners, for you to understand what it's been like for me to interview people like Dr. Feldman and Andrea. I mean, and I'm not putting myself on a pedestal here, so please don't think I'm being narcissistic, but seriously, when, you hear doctor this or someone's written a book, I've seen, and I did it myself when I first started my show, and I would be I'd be interviewing Dr. Gabor Mate or whoever, and I would, oh my gosh, I'm interviewing this doctor or this person that wrote a book, and kind of, I call it celebritizing. And then you get to know the real person, and that their life is not paved in rose petals, and that many times they've made a lot of money, but they've put it all back into this good work that they believe in. And they aren't doing this for adulation. They're doing this because there's a need. They're extremely empathic and caring people like you are, both are. So it's like, I'm lucky that I get to interview, that we have a reason to have a conversation by me having a radio show. But I guess that's the point I'm trying to make, is it's so much of your heart and soul and your money goes towards these things that you believe in, and people don't really, I think, have maybe an awareness around it. And I would imagine, and then I'll shut up because I'm not supposed to be talking this much, but I would imagine that some of the biases around people just can't understand why someone would do this. And so in a way, like racism, you can't get someone out of that hatred easily. It seems somewhat, that same, it's not the same thing, of course, but that same type of anger or that same type of roadblock where people just don't have compassion for it. Does that sound like I'm on the right path?
Yeah, back in something like 1994, I became so aware of those issues that I wrote an article for a medical journal about it, in which I talked about the reactions of the medical community toward these patients and to people who attempt to treat these patients. And the anger and aversion that I identified back then still tends to be prevalent. For example, when I talk with people and ask them open-ended questions like, how would you approach these patients? The first thing they say is, well, I'd establish a contract whereby if they harm themselves again, they're fired from therapy. I terminate the therapy. So we have this contract. We have this contract, and they're not allowed to break the contract. I won't collude by allowing that. And that is the exact opposite of the approach that needs to be taken. People need trusting relationships, not ones that are so fragile that if they, it's kind of like saying to a schizophrenic patient, have one more delusion and you're out of here.
It is saying that too.
That's what they do.
That's why it becomes a disorder, because you can't stop doing it. It's impossible. Exactly. And it's recoverable. Obviously, Andrea, it's recoverable, but when you're in it, you can't, there's not, and that's, I think, what people don't get. Like, you're not doing this. You are doing it on purpose, but that's the disorder of it. You can't stop doing it on purpose.
But may not know why, and they need a therapist's help in a lot of cases to figure that out. I'm sorry, Andrea, I cut you off.
I'm not so sure it's that much different than, an addict, or someone who's, say, using heroin. They know it's going to kill them eventually. They know it's really bad, but why do they keep using it?
Yeah. I have this one of our podcasters named Johnny Calloway, does a show, Morph Into a New You, and he, had a horrific childhood, lots of trauma, and that's what addiction came for him. He's, been very open about it, saying he literally was like looking up at the sky, saying, God, as he's injecting himself with heroin, is this enough to kill me? Will this do it? Because he just wanted to die. And there wasn't any stopping that. But he's in, long time recovery.
I could explain one other part of it if you'd like.
Please do.
Right. I do recall prior to creating an incident, whether it was, injecting something or taking massive amounts of different medications or what, or there was many different ways I hurt myself trying to, break bones and things like, right prior to the incident, I would realize I was typically in a lot of emotional pain, and I just didn't know what to do about it, because obviously during my childhood I was not taught any effective coping skills. And with the lack of coping skills, what does someone, like me, do with that kind of emotional pain? And it's a very difficult position to be in. And I knew that the minute that the illness would begin, like, for example, the fevers would start. I mean, I would get fevers, around 105 or so. And when you're that ill, if you can recall, being very sick, having the flu or something, you don't really think about anything. You don't feel anything. You're just in this state of being, completely like separated from reality and just this distant state. You just sleep, and your thoughts are just, your mind is blank, and I knew that that's what was about to happen. I would be in the hospital. I would not feel any pain. It would all be gone, and that's what I was looking for. It is almost like the euphoria for the heroin addict. It's like I was going to get that same feeling that I knew I got every single time. So I don't know if that helps.
It totally does. It totally does. So what do you do now because everyone's looking for that high in life, and and then as we evolve, from traumatized childhoods, we find healthy ways to get it. So what are some things that you do to have a healthy relationship around that?
So first of all, I believe when it comes to a difficult childhood or PTSD, that, you have to, I believe it's very important to tell your story over and over and over as many times as possible until some of the, the pain is removed from the actual situation. And so it was very cathartic for me to write the book. That was really very helpful. And I think I think it's important to just be in a very trusting therapeutic relationship and someone who is non-judgmental, the way Dr. Feldman is.
Yeah, that helps a lot. It helps a lot. Yes. Yeah. He is so compassionate, and we're talking about you as if you're in the third person, Marc.
Well, as long as you're saying nice things, I don't mind.
Yeah, I mean, you have to have this level of compassion to not judge this, and but I want to go back to Andrea. What do you do now to fulfill yourself? What are some things that you do that are the healthy place to go?
I think I learned that I have to feel the pain, and there is no escape, and I can't stop it and hide it and make it go away. That if something is very painful, I have to feel it. I also remind myself that I've been through the worst possible. I lost a child, and it really puts everything into perspective, because when things happen at this moment in my life, it just doesn't really hit me as hard, because it just seems like the worst thing has already happened. Unfortunately, I live my life fearing the worst, because I've been conditioned by having so many bad things happen. Yeah. So, sometimes I become a bit obsessive about what is the next terrible thing that's going to happen.
Oh yeah. You're always waiting for that rug that's going to get pulled out from under you. Yeah. That's a hard one.
Definitely.
That's a hard one to let go of. I had a really good therapist help me with that, because I would catastrophize. And so it wasn't even happening for real, but it was real in my mind, because I would create a movie, a motion picture out of a scenario that didn't even happen. So, but yeah, really, that's why I love mental health, man. Those therapists that come in and are compassionate and say things like, I want you to say every single time you do that, and I don't care if it's 1,000 times a day, the minute you start catastrophizing, say, that's a story that doesn't need to happen, and use an eraser in your mind and erase everything you just wrote in your head. And I was, and I probably did it 1,000 times a day for a long time.
Yeah.
I also believe in mindfulness. That's been very helpful.
Good.
And I have a very supportive husband, thank God. And he knows how neurotic I can be at times, and he reminds me that to live in the present, which is what's very, very hard sometimes for me.
Isn't it interesting? I mean, for both of you, this, and then we'll close the show, but isn't it interesting how when you have these long-term partnerships with people, how your love can change into something where, they loved you at your absolute, whatever, your worst. And they're supportive of you. And you look back at that over time and you're like, wow, that's amazing. I am lovable. I'm worthy of love,
Exactly.
Yeah, not everybody has it, but it's so irreplaceable when somebody does.
Yeah, it really is. I mean, it's amazing. So I know you're married also, Marc. So, well, I want to make sure our listeners know, Andrea Avigal, her book is Secrets Unraveled, Overcoming Munchausen. And Dr. Feldman, Dr. Marc Feldman, and it's M-A-R-C, because autocorrect likes to put a K in there. It's M-A-R-C Feldman. You can get his book. It's called Dying to be Ill, True Stories of Medical Deception. But I'd like both of you to share, and we'll start with you, Andrea. Where can people find out more about you or how to reach you if you want to be reached?
If you want to read about the book, you can go to Amazon, and I have a website, secretsunraveled.com, and I'm available if anyone wants to reach me at secretsunraveled@gmail.com.
Wonderful. And you, Dr. Feldman?
Yeah, I have a website helping to support the book, but providing a lot of additional information at dyingtobeill.com. And people can email me through that website. There are forms that are on every page that, in fact, encourage people to come forward and share their stories if they wish.
Well, thank you both so much. And I have to say again, Andrea, how brave of you. So I'm honored that you would share this on my show. Thank you.
Thank you. Thank you for having me.
Absolutely. And Dr. Feldman, you know we love you around here, so keep doing what you do. And I think it's funny, just for our listeners to know, I wanted to talk about this subject forever. I knew it existed. I had seen movies, there are a few movies about this, mostly on the by proxy side. And even the movie with Bruce Willis.
Sixth Sense.
Yes, that touches this in there. And so I knew about it. And of course, I grew up with it. And I kept going, I just can't find anybody. I can't find anybody. And Melanie's like, you can go to Munchausen.com. I mean, why didn't you think of doing that?
Yes, and you still can. That's a fine address to use. And I check it at least twice a day so people can reach me promptly.
Exactly. It's right there, right under your nose. Well, again, Thank you both so much. And I want to say thank you to our listeners for another edition of Mental Health News Radio.
Without good intentions, I heat up and act on my emotions.
Thanks so much for listening to Mental Health News Radio. Our podcast can be found on iTunes, Stitcher, and hundreds of other podcast apps. Or you can visit our website at mentalhealthnewsradio.com. If you have a question or would like to be a guest, become a podcaster on our network, or join the amazing organizations that help keep us on the air, please email us at info@mhnrnetwork.com. Get ready for that special goodbye from our resident therapy dog, Miles, and a special thanks to Emily Sohn for letting us use her incredible song, Cordial, for our podcast music. Listen to the full song on SoundCloud at emily.sonne.
Don't be surprised when I don't hate on you. After all, we promised we'd be cordial. Sometimes in you I can fight it.
Good boy.
Hey folks, Dirk Bentley here. If you've seen one of my concerts, you know I'm all about energy. Performing, recording, traveling, being a husband and a father, it's a busy life, and I need to be 100% every day. So when my battery starts running low, I grab a sugar-free, vitamin-packed 5-hour energy shot. It tastes great, and it gets me back to 100% fast. Try it. It could work for your busy life too. For more information, visit 5hourenergy.com.